The beautiful sceneries of Lake Victoria welcomes us into the lake region, comprising of 5 counties in Kenya: Busia, Kisumu, Siaya, Homa Bay, and Migori. However, this abundance of water brings with it a risk to the residents of the region as they face diseases such as intestinal worms and Bilharzia.
Ugonjwa wa minyoo hiyo, nilikuwa na mimba na nikazaa mtoto na tumbo ikaanza kuniuma.
Inaweza pita kwa mguu, kwa maji chafu, inaweza pitia kwa hata kwa chakula ile tunakula ile chafu chafu.
In response to the pressing health challenge, the Ministry of Health, in close collaboration with various stakeholders, embarked on the extensive survey. The results of this comprehensive study were instrumental in shaping the mass drug administration program, which was subsequently implemented in 5 counties, including Kisumu, Busia, Homa Bay, Migori, and Siaya.
So we conducted the granular mapping just for us to be able to estimate the burden estimates for Bilharzia, which we refer to as schistosomiasis as the technical name, and soil-transmitted helminthiasis, which is of course the intestinal worms in the lake region. And this was basically for us to understand where the disease is, who is it affecting, and where we are going to now put the control measures.
Minyoo or worms, they are with us. Many people, they have worms, but they are not aware. Many people are suffering silently.
The meticulous mapping carried out in 2021 revealed that out of a total of 180 wards, 71 wards had a schistosomiasis prevalence of 10% or higher. The findings made them eligible for annual mass drug administration in accordance with the World Health Organization's guidelines. Furthermore, an additional 89 wards exhibited schistosomiasis prevalence surpassing 2%, meeting the criteria for inclusion in the MDA program under the Breaking Transmission Strategy. On soil-transmitted helminths, 78 wards demonstrated prevalence ranging from 2% to 10%, while 17 wards recorded a prevalence between 10% and 20%. A total of 3 wards displayed STH prevalence within the 10% to 20% range. However, none of these figures exceeded 50%. Consequently, 98 wards met the criteria for annual MDA under the Breaking Transmission Strategy.
The World Health Organization recommends periodic treatment for all populations at risk for schistosomiasis and both STH and other neglected tropical diseases.
WHO, who is our partner today, in the 2021 to 2030, the NTD's roadmap titles Ending the Neglect to Attain the Sustainable Development Goals aims to decrease the number of people needing treatment for NTDs by 90%.
The primary objective of these efforts was to proactively manage and ultimately eliminate neglected tropical diseases. Aligned with the World Health Organization's roadmap for the elimination of NTDs from 2021 to 2030, the Ministry of Health, in collaboration with WHO, aims to provide preventive deworming treatment to 18 million people.
If you look at the transmission of Bilharzia especially, it is usually found where there are freshwater bodies. And you can see within the lake region, we have a very big belt of Lake Victoria, which is one of our transmission sites for Bilharzia.
The lifestyle along the beach is probably not as the same as the lifestyle in urban area.
And the practices where people feel the heat and they want to swim in the waters, they also take their clothes there, wash them in the lake. They also take even their utensils. Those are some of the practices and the behaviors that put the lake region at risk of STH and Bilharzia.
If we could integrate the ODF with water, sanitation and hygiene, it will play a really huge role in eliminating in STH and SCH, and also for schistosomiasis, if they embrace behavior change, plus now the medication, we will be able to eliminate the disease.
For this MD at the Lake region, we're using 2 medicines, that is praziquantel and mebendazole. We're using praziquantel for bilharzia and we're using mebendazole for intestinal worms. We quantified using an estimation of 2.5 tablets per person for bilharzia and 1 tablet per person for intestinal worms. And this is based on the WHO guidelines that has been set for us, the treatment of these diseases.
The AIHD's vision is an Africa where people live with dignity, and as we know, neglected tropical diseases are poverty-related diseases, and their goal is to work with communities and to improve the well-being of the communities and the nation at large, and being involved in neglected tropical diseases is part of their mandate.
As a nation, our dedication to eradicating NTDs remains steadfast. If we want to eradicate some of these small diseases, nimeongea mambo ya kujipanguza na ile leso umetoka kuchukua samaki nayo. Kwanza unaiosha. Ukifika nyumbani unanawa mkono kabla hata ushike mtoto. Ukifika nyumbani chemsha ile maji unataka kunywa kabla uikunywe ama watoto wako waikunywe. Watoto wakitoka nje kucheza, wakirudi nyumbani, it is important that they are taught hygiene.
To overcome the myths and cultural beliefs surrounding NTDs in society, the government has deployed community health promoters. The individuals are working diligently to sensitize communities on hygiene and sanitation practices, which are crucial for the elimination of these diseases.
There are some myths and misconceptions that they are arising about these medicines, them having a lot of side effects. However, we are encouraging the community members to have a meal before having these medicines. This reduces the side effects of the drug, and they'll be okay after they've taken the medicines.
Before, they used to think worms are they only affect the under 5s or the young children. But this time around, the community has not had problems.
Community actually has received the exercise very positive. We have been moving from house to house to do education before giving out the drugs. The reception is very friendly. The community is very happy.
We were able to work very closely with the county governments, the local administration. These are the chiefs, the assistant chiefs, the admins, the ward admins, and also the village elders. This includes also the community health workers to ensure that sensitization is done to each and every person living in these endemic areas. Additionally, one of the strengths that we were able to leverage on is the using of the local radio channels, where now the health promotion officers were able to relay this or sensitize the community members using local radio channels, where they were able to speak in their own language for people to be able to understand.
Kwa hivyo tunaomba tupate kuzingatia zoezi hili ili kuweza kuondoa minyoo.
Sasa kazi yangu sana ni kushikana pamoja na wananchi. Kama kuna sheria za serikali lazima niwafahamishe ili tushikane pamoja. Hasa kuhusu hii ugonjwa inanibidi niambatana na wahudumu wa hospitali kuita mabaraza kuadhimisha kwamba kuna ugonjwa aina hii, na kama kuna ugonjwa aina hii inafaa tuchukue hatua hii.
Mimi nimesikia vizuri, daktari wameniletea madawa. Najua ugonjwa wa minyoo ni ugonjwa mbaya. Leo nashukuru daktari kuniletea dawa ya minyoo kwa boma.
Mashirika sinakuja wengi, lakini sisi tunapagiwa kama walemavu, tunawachwa nje. Lakini hii ya mpango ya minyoo hii, sisi kama walemavu tumeshukuru sana. Tena tumepiga asante sana. Tumeingizwa ndani na kupita kwa mafundisho ili tumepata kupita kwa mwalimu. Sisi walemavu tumekubali ili tutumie hiyo madawa na tupate nafuu.
We are giving the exercise at household level. Now we have that ownership. The community feel that they are involved in the exercise and they are part of the exercise.
Ensuring the sustainability of this project and aiming to eliminate 90% of the diseases by 2030, the Ministry of Health has worked closely with the county governments. Additionally, they have forged new partnerships to strengthen their efforts in eliminating these NTDs.
For the longest time, neglected tropical diseases are not given the priority that it deserves. So beyond this launch, we are really looking forward for the county governments to be able to prioritize NTDs within their budgets and for us to have domestic resource allocations for NTDs. That is more sustainable for governments.
With the cooperation of the community to eradicate these neglected tropical diseases, going by the approach of the national government, which is basing a lot of emphasis and financial support on preventive and primary and public health, it is not expensive to eradicate these diseases.
We are also increasing awareness to the community members so that they also understand what these NTDs are and they can also take the preventive measures, because we believe change will start from the community. So having a lot of community involvement and engagement so that we get solutions from the community members.
Ile tunasasuia na kupita madawa na pia kukusio kulingana na mazingira ikuwe safi. Vitu ile tunakula pia ikuwe safi. Mahali kama tunaenda kwa bafu hata kuoga, tuvae viatu. Inasuia, unajua sinapitia hata kwa viatu, kwa mguu ndani pamoja na chakula.
The intervention is health education. That is number one. Number two is to encourage our people to have improved sanitation, that is latrines. At least every household should have a latrine. Another intervention is to have hand washing facilities within every household. Another intervention also is to have safe water. We can have enough chemical to treat waters.
NTDs will stop being NTDs when we give it the priority that it deserves.
Pamoja tuangamize minyoo na tukuze jamii.
Let us work together, eliminate worms, nurture families. Angamiza minyoo, kuza jamii.
Indeed, as the saying goes, prevention is better than cure. Through these collaborative efforts, the Lake region in Kenya is making significant strides in creating a healthier and disease-free community.